Well, good morning again. This is an interesting study, and I think you'll all find it a little bit interesting. And if we are an elite group, I think you're going to be very surprised at what this result is. But this was a study back on rubber dam use during root canals, and I was actually one of the ones that did this study. And the aims of the study were, among the dentists who report doing some root canal treatments, first, we wanted to quantify who was using a rubber dam. Then we wanted to find the percentage. If you didn't use a rubber dam, all right, what other form of isolation did you do? And we wanted to test the hypothesis that a certain dentist or practice characteristics might be associated with a rubber dam. So the dentists were invited to participate in the update survey, and the data was collected between December 2010 and May 2011. And to qualify for this, you had to have been involved in a previous study. And the main questions asked were, do you personally do a root canal? What percentage of those people would you use a rubber dam? And if you don't use a rubber dam, what other type of isolation? And the response was 74% of the eligible practitioners responded, and another 76%, 553, do endodontic treatments. Now, of the 553%, 45% use rubber dams for all endodontic procedures. And 23% use it 51 to 99% of the time. 17% use it for less than 50% of the root canal treatments. And 15% of our elite group never use a root canal during treatment, rubber dam. So when you looked at the characteristics of who the survey group was from, it was pretty diverse. I mean, you've got everybody from Alabama. We were good it was pretty much the usual, the research network. I would like you to note, we did have 14 endodontists in the survey. So there's our specialist. All right, when you look at characteristics of it, go back down there to endodontists. 100% of them used rubber dams all the time, 100% of the time. And here it got a little more interesting. The Alabama group, 100% of the time was 26%. The graduation date was interesting. 2000, if you graduated at the year 2000, you were at 54th percentile of using the rubber dams. I was interested in our Scandinavian, our Norwegian friends, and they were at 32%. The group practices, the PDA, they were up a little bit, and I asked Dr. Gilbert about that, and he said probably that would be standard protocol, or that was just the way it was done in their group practice. So here we go. 54 respondents never used rubber dam, but used another type of isolation. So looking at that in the study, 45 used cotton rolls or gauze, and 8 used isolite. And I looked up isolite because I was not real familiar with it. And if you go to the website, it would definitely provide throat protection, barrier protection from aspiration of the file. It fits against the back of the throat, makes a nice barricade. It would keep moisture out of the mouth, saliva flow. I don't see how it would prevent any clavicular flow if you have one that was subgingival in your prep. It looked like, as far as patient management, it would be a very good system. I did, when I was reviewing the slides or the video, it didn't show isolite, anybody using it for a root canal on their website. Even the hygienists were using it. So out of 127 respondents who used the rubber dam less than 100% of the time but reported some other type of isolation, 95 used cotton rolls or gauze. And of course the gauze could make a barricade in the back of the throat, and 14 used isolite. And so the conclusions are 45% of our dental practice-based research network dentists, our elite selves, do use a rubber dam all the time. Other forms of isolation are used, and certain dentist and practice characteristics are associated with the use of the rubber dam. For example, the region, our Northwest group, our HMO group, they used it a high standard at the time. The endodontist used it 100% of the time. And after the year 2000 in dental school, you had a higher percentage also. And that's just education. All right.